So we're just going to talk about the bioidentical hormones and some symptoms, some benefits, some risks. There's really not a lot of risks. This is the difference. So there's bioidentical and synthetic. Bioidentical is closest to our genes. It's compounded and made with plant-based material. Also, we use natural sources. They make it, they compound it to where it replicates our genes. Synthetic is more like made with abnormal, not natural products. And so they don't work well with our bodies. Like I said, bioidentical hormones is chemically made identical to our genes. The synthetic hormones are made, normally it's made from like horse pee, different stuff like that. So it's not really made for human bodies.
Is it an injection?
You can do injections, creams, troches. You can do pills, capsules. There's different ones that are compounded. Each of them are a little different. Some of them you have to do daily, like injections for females. If you use testosterone, it's once a week or twice a week if you microdose. And then you have the troches, which you dissolve. It's kind of like a sublingual. You put it between your cheek and your tongue, and it melts. And you do that every day. And then progesterone, they have capsules, the creams. A lot of people don't like the creams because they're messy. They rub off. They can transfer to your partner, stuff like that. There's a couple options.
Why would they do synthetic over the other one, bio, whatever?
So bioidentical hormones are not covered by insurance.
Okay.
So synthetic is made by big pharma.
Got it.
And so that is what the insurance companies will approve.
Okay.
Bioidentical is compounded in a compounded pharmacy, and the insurance companies do not pay for that.
Gotcha.
So it's money-based.
It's money-based. Everything is
I
money-based.
was gonna say you're gonna find that a lot.
Yes.
Yeah.
Everything in wellness is money-based. That's why I don't take insurance, because if I take insurance, then I have to give you the garbage synthetic stuff when I know the bioidentical stuff is what works best for you. They have less side effects, better efficacy rate. Your body absorbs it better because it's more natural.
Sure.
Obviously, no medicine is natural, but it's more natural than stuff created in the lab. Bioidentical hormone therapy has been around for a really long time. They're actually doing new studies that's coming out disproving all of the old studies where back in the day they said, oh, hormone therapy causes cancer, it causes cervical cancer, breast cancer. For men, it causes prostate cancer. All of these things are actually being disproven right now. They're doing a bunch of new studies, and they actually just recently took the black box warning off of testosterone therapy. They're seeing that it actually helps for women. It decreases your risk of osteoporosis. It decreases your risk of cardiovascular disease. It can improve your mood every day. It helps with weight loss. It helps your skin. Our bodies need these hormones to feel our best. And in healthcare, they want you to do sick care. That is why the insurance doesn't take bioidentical hormone therapy.
They don't want to be preventative.
Exactly. They just want to help you when you're sick, and that's it. They don't want to prevent it, make you feel your best. Some symptoms, like women going through menopause, you can get hot flashes. You can have painful sex. You can have vaginal dryness. You can have mood swings, difficulty sleeping, difficulty urinating. You could be urinating on yourself. Acne. There's so many symptoms related. I think I made a whole list. There's heavy periods, trouble sleeping, night sweats, mood swings, decreased libido, hot flashes, dry, thinning skin, joint pain. You wouldn't know. The women who are going through menopause, they have frozen shoulder. You get frozen shoulder and they just think that's normal. That's not normal. That's because you're lacking hormones. If you go see your primary care, they're just going to inject you with corticosteroids. They're going to give you Medrol dose packs. They're going to send you to therapy. They're going to, which therapy's good, but you don't need it because really you're just lacking in hormones. So if they would do like a full panel of labs, they would see that your hormones were off. Mm-hmm. And we have a lot of sex hormones. We have estrogen, progesterone, testosterone. And we have vitamin D, which you don't know is a sex hormone. But these are all avenues that should be tested when women come in with frozen shoulder, but they don't. They just start pushing surgery and pushing different things. The hormones can help with quality of life. They can improve your sex drive, but they can help with sleep. They can help with mood. People with depression and anxiety, they think that they need to go on medication like SSRIs and different things like that, but they really don't. Really, if they just get their hormones balanced, that will resolve all of those symptoms. Now, there are people who do need medication, people with bipolar, schizophrenia. Hormone therapy is not going to fix that, but it will improve their mood and their symptoms. Key hormones involved, which we talked about, estrogen. Estrogen affects your menstrual cycle. If you are menstruating, you do not need estrogen. As a woman, you should not take any estrogen therapy if you are currently menstruating. Women who are postmenopausal, which means you haven't had a cycle in 12 full months, you go through menopause on one day, and then after that day, you're postmenopausal. Anyone who is 12 months with no cycle is postmenopausal, and you would be benefiting from estrogen. There's different types of estrogen. Like I said, it helps prevent the osteoporosis and fractures, which a lot of women can experience. As we get older, our bones become brittle, any kind of fall, you're in the hospital. And everybody knows when you get a fracture and you're older, the downtime is never the same. Your quality of life is just never the same. Progesterone also helps regulate your menstrual cycle. Nowadays, it starts in your 20s, but perimenopause can start from 20, 30, 40. Anybody can experience these symptoms, and it is younger now than back in the old days because of all of the estrogen, like receptors, all the creams and shampoos and Teflon chemicals that are in our cleaning products. All of these things are hormone blockers, and they can definitely affect the way we feel. Progesterone is the one hormone that will help with sleep, so everyone loves their progesterone. They take it at bedtime and then they sleep like babies. Yeah, it works really good. If you are on progesterone and you do not have a menstrual cycle, you should take estrogen so that they're uterine protective.
I used to not sleep for longer than like 4 hours. I can sleep for like 7 to 8 now, like a normal human. It's pretty good.
Can you repeat what you just said? I'm assuming that's because of the thickening of the uterine lining, but repeat what you just said about if you're on progesterone, you should be taking estrogen as well.
If you're not menstruating.
If you're not, okay.
Yeah. So women who haven't had a cycle, it's really important to menstruate. You need to shed that lining because that increases your risk of cancer. It's important to have them hand in hand to help prevent cancer. This is the best for libido. When women get on this, they will tell you they feel amazing. They wake up, they have energy. They're begging their husband for sex, and this really improves marriages right here. Your testosterone's low. This will definitely help. And, women don't think that they need testosterone, but they actually do. It's actually one of our key hormones.
I've heard this. I don't know if it's true. Do you have a greater amount of testosterone in your bodies than estrogen?
No.
Maybe you have PCOS.
Yeah, only certain people will have that. It should be all pretty balanced. Women have a good amount of testosterone in their body, but it's not more. What you do is you do this symptom assessment, which is on that paper. We go through it and see what your symptoms are. Then we do blood work. Blood work will show us everything. But some people, their blood work comes back and they're okay, right? But they're severely symptomatic. And so we will start you on hormone therapy and you will notice the difference. But blood work today, if you're in normal range, that's not optimal range. There's normal range and optimal range, and optimal range is where we feel our best. We definitely want to make sure we have all of our numbers in optimal range. And then we create like a care plan, a treatment plan. We decide which hormones you need and different stuff. And then we monitor you. I check in with my patients every 12 weeks. We do lab work. Once you're stable, you're happy on your dose, then we do 6-month lab work. I'm always available to my patients. They have my phone number. It's a cell phone. It's a business cell phone, but they can text me. They can call me. That's part of their membership. Whenever they need anything, they can reach out to me, and then I'm there to assist them with any of their problems. So hormone-related side effects, you want to talk to your primary care or your hormonal therapist, whoever you're going with. Not a lot of risk. There are side effects. If you're on progesterone, you can develop bloating, and it might be too strong for you. The capsule might not be the best. You might need to do sublingual. You might need to do cream. So there's different options. Some people will have thinning hair at first, or they'll have weight gain at first because our bodies have to adjust to the medication. It takes a good 6 months for females to really get tuned in. Once those happen, all of those symptoms normally go away. And there are things to counteract those symptoms. And that's it. Conclusion. Any questions?
I have another question. Other than the libido, are there certain symptoms that would imply that maybe your testosterone is...
Energy, fatigue,
Okay.
the libido. Most of the time it's libido for testosterone and energy. If you have too much testosterone, you'll be hairy. You might get some facial
Weight
hair,
gain.
yeah, different stuff like that. You might have more broader features.
Never heard vitamin D as a sex-related component. Can you speak more about that?
If it's a sex hormone, I don't know what makes it a sex hormone. I've just learned it in my courses that I've been taking. I didn't know that. That's actually news to me. I just started this new course and they told me that vitamin D is a sex hormone. I guess the way it helps regulate the progesterone. I guess when your vitamin D's off, it can decrease your progesterone and your estrogen.
Like when you start hormone therapy, when's the stopping point?
Never.
So you're on these injections or pills or whatever forever.
I mean, you can get off of it.
Right,
But
as
you'll
long
go
as
back to feeling the way you were before. You can stop it, but most of the time when people get on it, they stay on it because they feel the benefits and
Is it expensive?
it can be, yeah. So like the 3 hormones is $235 a month. And that's forever. But that includes everything, like the 3 medications, the follow-up visits, the lab work. Some people charge more. I know that. I think one hormone starts at $175, and then 2 hormones is like $205. And then a consult is $249. That includes the visit and all of the lab work. And I check thyroid, I check a full basic panel. We check for diabetes, check DHEA, all your vitamin D, B12. Good?